Now joining us at the studio is Dr. Khaled Awad from CMC Clemenceau Medical Centre to discuss with us heart palpitations and its common symptoms, which happens to many of us. Doctor, first of all, thank you very much for joining us.
Thank you for having me. Good evening.
Doctor, tell us the reasons that this feeling that, you know, your heart is beating extremely abnormal, let's say. And is that a clue that something is not right in your heart? And the abnormal heartbeat ranges from normal to sometimes abnormal ranges. What are the, signs that there is something not normal and this is different than that?
Yes. You know, in the last years, we are experiencing young people who are coming to us and complaining about like feeling their heartbeat. So most of the time, I want to assure the viewers, it's benign, so it's not dangerous. But they are feeling like discomfort. And the reasons vary from genetic ones to it depends on our lifestyle. You know, we are spending more time in our social media, and we're having too much stress, and we are drinking more energy drinks, having shisha, caffeine. So these are factors which affect the heartbeat.
How do you know that this palpitation is normal and this is not? What differentiates each from the other?
Sure, it's difficult for the patient to do the difference, to tell the difference. But normally, if it's not ongoing, so it's not a dangerous one. So it comes like attacks. So it comes and go, it comes and go. So it is the time, if it's annoying, for them to go to the doctor. And the doctor would feel the pulse, do an ECG, and then we'll catch it from there.
ECG, maybe fixing a Holter, maybe doing a CT scan, right?
Exactly. I mean, it's very difficult sometimes to catch it because they're having it and they're coming to you. But in this way, the new technology might help.
Right.
So the smartwatches, there are some smart devices.
Right. Those help a lot. Let's go back to the lifestyle that you were talking about, the 21st century lifestyle. You know, sitting behind a computer a lot, not doing a lot of physical activities, shisha, caffeine, energy drinks. How bad are these things that, we use in our lifestyle?
Sure. You know, our heart is an electromechanical pump, so it's an engine. So an engine needs also some time to relax. So even when we are relaxing, we are not really relaxing because we are concentrating on our Instagram and Twitter and TikTok and all this stuff. So we need to give ourselves a pause or a relaxation period, and we have to pay attention to our body and our lifestyle, our movement. Right. So if we spending more time in the social media, we are moving less. So these are things which affect our heartbeat and our heart directly.
So you're suggesting people to go outside, change their lifestyle. That's going to probably help.
Exactly.
So what are the signs that now is the time to see a cardiologist or a doctor?
So, some of the patients have difficulty to tell to tell us what they really having, so they can't express themselves. So it goes from just having a missing heartbeat or dizziness, chest discomfort, shortness of breath. So sometimes pain. So when they are having these symptoms, they'd better go to the doctor and talk to him.
So they should look out for these symptoms of not having enough, Is it the short breath? When you said people don't have this enough, breath, they're out of breath. Is it during activities or just sitting?
At rest.
At rest.
At rest. And sometimes if they're having their symptoms during activity, it could have many reasons, but it is the time to go to the doctor.
And the minute the doctor knows that there might be something wrong, what did they start doing?
Exactly. So we start doing a general cardiac heart checkup. So we do an echo, we do a stress test, and we do a Holter. And sometimes if we are unhappy, we are not that happy, so we have other tests like CT scan CT and MRI of the heart. It depends on the case.
I was, told by a cardiologist that now there's a lot of cases of patients needing stent at a young age.
That's very true. And we go back to our lifestyle, lack of movement. We are eating maybe junk food, or we're not paying attention to a balanced diet. and these like energy drinks, smoking, shisha, these are things that affect directly our heart and our vessels.
Dr. Khaled Awad, thank you very much for joining us.
Thank you for having me. Thank you.
Pleasure.